a little bit deeper on healthcare reform and the changes that are happening. What I thought I'd do today that I think will stimulate some good conversation, the last 3 days actually, I've been kind of embroiled. I was over in Cedar Rapids for a joint presentation through Health Underwriters and the Kelly Insurance Center for a 3-hour CEC with Jess Patton. So that was always helpful. When you get time with Jess Patton, it's always a good thing. Jess is so well connected inside of Washington, D.C. So I'll share with you some updates from him today. And then the last 2 days, I was over in Cedar Rapids at a NAIFA state conference. And so I actually delivered this presentation yesterday, but it was one that Brenda put together, and my business partner, Brenda. And so I want to go through this with you because it's different than what I've been delivering to you guys. And so you might want to see this one and go, oh, okay, you'll still pick up some new things because we each tend to highlight some different things. So as I go through the presentation I used yesterday at NAIFA, I'll bring up some of the points that we discussed yesterday and some of the new pieces that we found. And then we'll have plenty of time opened up for other questions and other things that you may have also observed or seen in the marketplace. So let's go up. I'm going to skip through a couple slides because, as you know, some of this stuff, this was the disclaimer slide for our presentation yesterday. And I do love this. This is a good, you know, we ought to have these little tidbits. It was signed into law on March 23rd of 2010. I mean, we just need to know that. And I don't know that it really matters, but look at where we are. We're 3 years later. And I guess my point, and maybe sometimes as you talk to your clients, this is moving forward. People keep, I think, denying wanting to talk about it because we think it's going to still go away. And you'll hear people talk about, well, my representative says we're going to, you know, repeal this thing. Well, I'll tell you this. At my NAIFA meeting yesterday, I was also there to hear our new insurance commissioner, Nick Gerhardt, spoke to us. And so it is moving forward. And for some of you, even I know with me, we're on a teleconference, I believe a week ago, where we had CMS and HHS and Nick Gerhardt, our Iowa Insurance Commissioner, on a teleconference, a webinar that actually I think it was just a teleconference, and we were talking about the issue of agents, navigators in our marketplace. So anyway, I'll share with you a little bit from that as well. So a lot going on, and I am your conduit to try to help you as well as all your other sources that you get. But I love that piece, too, about Nancy Pelosi, and that is the reality that we're still finding things that are in the law now. She said we have to pass a bill so we find out what's in it. We're still finding out what's in it, and there's further guidance that's coming down about the things that are in the law, about how that's going to be translated out into the communities. So yeah, we're also still trying to not panic here and make sense of it all. But one thing I did want to talk about, because there's been some confusion. So let's just, a little of this is going to be going back and continuing to lay our foundation. Remember that grandfathered plans are those plans that were in existence prior to March 23rd of 2010 and have not made significant changes to those plans. Now, if it's an individual client and they went through underwriting and they went in and got a new plan, then of course they're going to be non-grandfathered. So it's anybody that's been sitting typically on an old pool plan or a group that hasn't made changes to their plan prior to March 23rd. So I then say those grandfathered plans won't have to comply with all of those market. They'll only have to comply with some of the market reforms. And I do have, you know, those are the forms. If you don't have these yet, you've got to get these. These are the, Wellmark, I think, did a great job, as any carrier could put timelines together, but I thought Wellmark did a really great job on their timelines. And there's one for the individual market, and there's one for the group market. And the individual market is, I'm just going to give you the form number, M23469. That's the individual market. And the small group market is M23465. But both of these documents have they're great for conversation starters with your individual or group clients. And it does talk about grandfathered and non-grandfathered and what applies to what type of plans. A common question you might get from a small group right now is, should I stay with what I have? I'm offering coverage today, even though I don't have to. Maybe I'm under 50 and I really don't have to, but should I? When you look on one of these timeline forms, you can see what things that grandfathered plans, if you stay grandfathered, what you don't have to comply with. And the two big ones that I think of are preventive coverage. Now, some group plans had some preventive coverage built into them, but Many of them did not, and many of the individual plans did not. So it's the preventive coverage, but it's also the women's preventive coverage, the women's wellness. And I've shared in some of our webinars the actual 10 essential benefits that must be covered, as well as the women's special benefits. And that's where you get into the contraceptive coverage that's so controversial. Plus maternity coverage for all is on essential benefits. And so there's interesting things that, grandfathered versus non, if they have to comply. So, okay, so I just wanted to kind of just revisit that a little bit. Now make a note, if you have some comments until I open it up for questions, just make a note if you have any questions or comments on grandfathered plans. And then, as you know, once a plan loses its grandfathered status, then it is subject to all the market reforms. And the fear is, and why Coventry and UHC have now come out with 12/1 for small groups, 12/1 renewal dates. Even if they're renewing, they've already renewed this year, or they're going to renew again if it's a plan that might renew in June or July. They're offering then a 12/1 renewal date. And what that's really doing is buying some of these plans, especially the grandfathered plans. They're buying them some additional time to sort out what's going to happen in this market, what are rates going to look like. And so also, if you're grandfathered, you don't have to embrace the rest of these changes, which most people believe is going to drive up costs. So that would be why you really want to sit down with those groups now. And again, if you have not positioned yourself out in the marketplace as the go-to person for health reform, you've got to do that. And the way you do that is start to let people know, and the easiest way to do it is by doing seminars. So either get comfortable with our presentations yourself. You can certainly build your own presentation, but use ours if you'd like to, or invite me or Brenda to come out into the marketplace with you and do a meeting, because there's no other way that people are going to be associating you with health reform if you don't step out. And if you don't do it, your competitor will. So just, again, make sure that you're getting comfortable with this so that you can explain this. But sitting down with those small group plans and saying, do you want to stay with what you have now? I've even had an agent call with a question and said, I've got a small group case. They don't offer it now. Should they? And they're small group. And so they don't even have to, but should they even offer it now before they hit? So at least buys them some more time. Because really, what does it all come down to for the small group? And I come back to this a lot, but it comes down to the small group is, should you be offering benefits because it helps you retain good talent or attract top talent? So anymore, I mean, yeah, we care about 50 and above, 50 and below, but seriously, that question, I think, for you has to be top of mind when you're dealing with your small business cases. You need to say to them, how important are benefits to how you run your business with your talent? Do you care about turnover? Do you have your top people that would leave you if you said, go into the exchange? Here, I'll give you another couple $100 a month, but go buy your own insurance. So many groups, if they don't offer coverage today, might be coming to you to say, should I? And one thing that you can say to them, well, it can't hurt. Let's get a group plan on the books now and then see what happens. And then at least you'd have benefits for a year, and then you can maybe make some other decisions. So anyway, just know either way, if they're renewing, they already have benefits. A couple carriers are offering renewals as of 12/1 to push this thing off as long as possible. And others might even say, I want to start offering it now. So, but this grandfathered thing still plays into it. And by the way, Blue Cross, and I don't have the communication on it, but I know I got this verbally by our representative last week, a couple weeks ago, that Blue Cross has grandfathered and non-grandfathered plans, on the individual basis and on the group basis, of course, too. And they've communicated that all of their non-grandfathered plans that have to comply with all these new provisions will automatically be moved into one of the new metallic plans effective January 1. So I'm sure they'll be communicating to their clients, which are our clients, right? This is why, you guys, summer training is going to be mandatory if you play in the under 65 or small group space. So just get yourself ready for that, and this is where you're going to commit to either be in this market or get out, right? Because if you want to just sell the Medicare products, that's fine. Then mandatory training is not mandatory, but just know if you have an under 65 or a small group case, you're going to need to find someone to partner with and split revenues or whatever you choose to do, but you won't want to write it. You really shouldn't write it. You won't be trained, and I got to tell you, we won't support you on writing it if you don't go to training. So sorry to be the hard line but I'm telling you guys, if you don't go to training, this is where all the information is going to be about how to talk to our groups, how to talk to individuals, what's happening, the new applications, the subsidies, everything, as you know, is changing. So summer training is going to be critical, and we've already got some dates, and I'll go ahead and let you know what some of those dates look like already for Wellmark. And they will, by the way, be offering general sessions, and that's fine. As long as you get to a training session with Wellmark, you're good with us for the under 65 and small group market. And so we're looking at the end of August, and we'll be pushing out an email to you with some dates, but I'll give them to you kind of as a sneak peek today, and that would be August 20, I'm going to pull it off the top of my head here. It's August like 23rd, 24th, it's 22nd, 23rd, or 23rd, 20, sorry. It's the last Thursday and Friday of August, and then the first Monday and Tuesday of that next week. So it's right before Labor Day weekend. It's kind of that time period. So it's end of August, and we'll get it out to you via email, but just know if you're planning on going vacation the 22nd of August through the 26th or 7th, then you'll want to go get general training at some general session with Wellmark. Otherwise, for sure with KHI, we'll be in Storm Lake again, we'll be in Fort Dodge again, we'll be in Des Moines again. We're even contemplating, do we need to do another session over in eastern Iowa. So based on our agents and our interests, we'll see there. But that's Wellmark, and I'm telling you, they're saying 8 hours. Okay, so 8 hours of training. Here we come. All right, so I think you guys maybe know some of this, but make sure you know the events to lose grandfathered status. And by the way, this is being recorded, so you can go back and look at this. We'll get it out on our website. We probably won't get it out there until next week, but just know that, and that this detail is out here. And then the way that this, I like the way Brenda set up this presentation, because now, and maybe this makes more sense, because now we've got laws that have already been implemented rather, and we've got some other things that are up and coming. And so I've highlighted the one that, of course, 100% preventive coverage, that's for non-grandfathered only. So there's one of those differences that don't need to be covered by grandfathered. So I highlighted that one. But you can see here, and some of this is all review. But I like how she laid it out. And again, I'm sharing this with you, so this might be one that you'd say, I like that one, and that's the one I want to talk from out in my community, and or have Lynn come or Brenda come and deliver it. And so then this is obviously big for the clients, and I think out of the whole healthcare law, it's this obviously no more underwriting. It's the guaranteed issue, and so that's a big darn deal. Now, two things right here, and this I got also directly from my NAHU and NAPA connections, that there is legislation being looked at trying to address the 3-to-1 rating methodology, saying that is just insurance companies are saying we can't make this thing work when you've hamstrung us basically in trying to get us to a 3-to-1 rating methodology, and then combine that with all I can do is ask age, address, and do I use tobacco or not. You know, they're saying, how are we supposed to keep rates in check when you've kind of hamstrung us? Because we know that the minimum loss ratio is also an issue, and I think that's on another slide. But so I just want to make sure you know that there's other things, and our job, we feel, is keeping you abreast of how the law will be changing from what it is today. And a lot of this won't impact us. In other words, I'm not sitting out there going, whoa, I need to design a new plan, or whoa, I need to worry about my rates. But we know Co-Opportunity Health, Wellmark, Coventry, UHC, we know. I can picture them like a duck, right? They're above water looking calm and cool, and underneath they're paddling like heck. So I think they're trying to figure out, how can I put together a product to meet these requirements of bronze, silver, gold, and platinum, and keep a 3-to-1 rating methodology there. It's just crazy. So anyway, be watching for that. And then here's the other thing, and I learned this from Jess from our CEC session a couple days ago, and that's around tobacco use. I'm going to deviate just for a moment, and I'm going to show you the application. So we know that, and this application we know started at about 24 pages, 21 to 24 pages, and then they say, well, now we've got it down to 12 pages, and that's great. But we've even heard now they're going to get it down to 2 or 3 pages, because they're telling us what makes it so lengthy is the number of dependents that you have on your policy is what stretches it out. Okay. So what I want to do is I just want to scroll through here really quick, and this is a draft, of course, but it's looking like with a lot of input from those organizations such as the Big I, from NAFA and from NAHU. Those are the organizations, and again, I plea to you, if you don't belong to one of the three of those organizations, work for us. We're not with that, but we need our voices heard because that's how important we are to drive this information down. I want to show you a couple things on here, and see how it's still got some numbers it doesn't know yet in here, but it's tell us about yourself. We got all that, and somewhere in here, and then tell us about your family, and then I want to show you where it talks about tobacco usage. And so here it talks a little bit about, do you file a tax return, and do you need health coverage? So it's going to get into this. It's also going to be asking about, you know, are you offered group coverage or not? So somewhere in here is the tobacco question, and I might have just skipped by it here. But the point I want to make is I'm just kind of going to scroll through here and show you. You see how it's asking you your current job and income, right? And so it goes down through, and this is going to be interesting because remember, there's some contingencies. If you're offered group coverage, you can buy through the exchange, or you can buy off market. But if you buy through the exchange, you're not going to get a subsidy. You won't qualify for a subsidy. And so here to talk a little bit about income and stuff, and then it says, thanks, that's all we need to know about you and now. And that was only the first 4 pages, and now it gets into all the other people you might want on your policy. So I was going to see, though, if it did say something, maybe I skipped over it about tobacco. And let's see if we need that. I might be just skipping over it here, and maybe you see it. But I want to comment on this. On the tobacco question, here's what Jess was giving us the update on. The tobacco question is, do you use tobacco more than 4 times a week? That's the question. And so yes or no. So if you use tobacco more than 4 times a week, so how do you define 4 times a week, number one? Does that mean I could smoke 4 packs a day, but I only smoke a pack a day, and it's only 4 times a week? Or is it actually I have 4 cigarettes a day? Or nobody knows yet. And this is what they believe is moving forward. So it's either a yes or a no, and then there's no way for them to go back and check. Because they're not going to be, you know, if you get diagnosed with lung cancer, there's no way for them to prove that it's because you smoked 3 times a week, yeah, or 5 times a week. So you can answer it yes or no, or there's no way to go back on it. And then remember the penalty. I don't know if you guys remember this, but the penalty is 1.5 times the regular rate. So let's say that I'm quoted $200. I'm a 22-year-old kid, and I'm not. My parents don't have health insurance, or they're deceased, let's just say. So I'm on my own, 22-year-old kid, and I need to buy my own health insurance, and I can get a policy for $200. But I say, yes, I use tobacco more than 4 times a week. Instantly, my policy goes to $300. Now, you guys need to know this. When you're sitting down with a prospect, and you're asking them if they use tobacco, and then you show them the rates. Oh, and let's even highlight this. Let's say they're sitting next to their spouse who is the same age, right? Different date of birth, but same age, same address, and this spouse does not use tobacco. So it's going to be highlighted right there. You're going to see it because remember, there's no gender differentiation now, right? So because there is no gender difference, so it'll become very apparent when you're sitting down with an individual client. If somebody's a tobacco user, they're going to pay on that same policy $300, and the spouse is going to pay $200, and they're going to go on to know why the difference. And what's going to happen, we feel, right? What do you think is going to happen? Well, I really don't smoke more than 4 times a week. I really only smoke 3 times a week. And so they modify their application, and away they go. So we're concerned about that, obviously, but that's just the way it is. So maybe something will get fixed on that later. But I did want to show you the application. Now, this is, of course, an online application intended to be completed online. And so I just have a plea out to some of you all that haven't joined the technology age here with things that are online. You've got to step in and get online, or really, I don't know how you're going to survive in this market, because they also say this is just the first phase, because then once they qualify, this is really to help them understand if they qualify for coverage or not. This is to qualify for the subsidy or not. And then once this goes through the system, there's another application that needs converting over our new agent portal next week. And so as soon as we get that, we'll get a lot of this stuff just put out there so we don't have to be emailing stuff back and forth. And I want to give you guys a heads up for those of you that are on the call today. We are going to have to, and I apologize, but we are going to in this new, since our website is cutting over kind of in phases, our agent portal is the next phase to cut over. We will be having to lock down some pages on our agent portal. And what that means is you're going to have to log in to get access to this stuff. Now, we'll help you every step of the way. And hopefully it's okay with you. We will have your login and password. So if you can't remember it, we'll get it for you. We'll be giving it to you. If you need to change it, you want to let us know so that we can help you with it and maintain it with you. But some of this stuff we're going to have to lock down because the things that each agency is doing differently, I think this is part of our value proposition to you. Because we don't charge any more for this stuff. This is part of our override that we will get on Business Written. So I just want you to give you a heads up on that real quick. Okay, so let me jump back here to the PowerPoint. Okay, and let me go back here on cost sharing limits and whatnot. Now make sure that you guys are all on board with this. The big thing that is consistent for all policies 1 to 50 non-grandfathered is this maximum out-of-pocket, right? The out-of-pocket max that's consistent for all policies, all carriers in this space of 1 to 50 non-grandfathered. So $62.50 for single and $12.5. So as I've been talking to carriers and we talk about the metallic plans and the bronze and the silver, gold, and platinum, the big things that are going to move, what I call move the needle on these plans, are going to be the deductibles and the out-of-pocket maxes. And to know that this is all they have to work with, I know right now that the $2,000, $4,000 limitation on those small group deductibles, I mean, excepting the HSAs, of course, but it's interesting. There's also some legislation drafted to change that and allow for the deductibles to be higher on small group plans. Because I think, again, these carriers are going, how can we keep rates in check for small employer groups? And because then the next thing that comes into play is partial self-funding. Because we've got a lot of groups and employers that are willing to say, hey, let me take a higher deductible, but I'll buy it down. And that helps lower the premiums and helps me be able to offer coverage. And so a lot that is being looked at. I know that right now, the $2,000, $4,000 for those small group plans only. That deductible max is not applicable to individuals. But again, these out-of-pocket maxes are applicable for 1 to 50 non-grandfathered. And then the other big thing, make sure you guys know this, that deductibles and co-payments apply to the out-of-pocket max. And I think that's been the other frustrating things for the carriers in trying to keep rates down, because this is one more thing that's going towards that out-of-pocket max, where in the past, maybe they could say, hey, we'll make this co-payment or this co-insurance, and we know that doesn't go towards the out-of-pocket max, so we'll get that all year long regardless, and that could help them. Maybe that's a point or two on rates, because they know that there is not an end to that risk, right? So anyway, just know that these are the things going on behind the scenes right now that carriers are struggling with to try to come up with competitive rates within the guidelines and keeping it so that an individual and especially our small group partners can afford to keep offering coverage. So here's again some of the additional requirements, just like we talked about, the cannot exceed 2,000, 4,000 today, except for the HSA plans. And I haven't seen guidance yet on what, clearly the HSA plans are the qualified high deductible plans can't be offering first dollar coverage. So, if that's all there is to it, then we can say, great, these are denoted as qualified high deductible plans, then they can exceed the 2,000, 4,000. But on those plans with first dollar coverage, they can't. And I think that's still what's being addressed, though, to try to, again, keep rates down. The new hire waiting periods, let's just make sure that we're clear on this, because there's confusion. And I'll tell you guys, there's stuff out in the marketplace. And all of a sudden they'll go, no, I've heard that's going to be postponed, that employer groups don't have to comply with that. And that is false. That it says effective January 1 of 2014, that new hire waiting period cannot exceed 90 days from date of hire. So I think, again, make sure you're out there talking to your small businesses. And even if you don't have their business today, maybe it's just a friend or a neighbor that has a small business. Make sure they're aware of some of this stuff. I think that, again, is going to set you apart as the go-to person for health reform in your marketplace. So make sure that the wording really needs to be, and that conversation should be happening now, and they can change it, with their carrier and make it effective January 1. But it really should say 60 days following the first of the month following hire date. So you kind of just have to work through that. And I'm sure there's maybe an easier way to say that, but it has to be 60 days from the first of the month following hire date. If you said 90 days from hire date, remember, most carriers don't offer odd effective dates. So if you hired somebody on an odd effective date, you'll be out of compliance because you'll be too many days past 90, right? So anyway, just know that that's another good tidbit that you want to talk about on that, okay? And then, of course, you know this, and we're hearing more about the dental and vision now for pediatric services. We know that that is up to age 18. We weren't sure what they were calling pediatric services, but now they're calling it must be offered on that essential health benefit, that medical plan, dental and vision, up to the age of 18. So that's an interesting one. And I'm sure, again, a lot of this doesn't have to do with us, you guys. You know the carriers are scrambling. They have to be. So they're trying to figure out, am I going to offer my own with a carrier like Wellmark who has their own dental plan? Maybe not as tough of a deal, but if there's a carrier out there that doesn't have their own embedded dental plan, they're obviously looking to partner or something, and as well for vision coverage. And then what does that mean? And so I think there was something that I got a little bit earlier here on defining what do those benefits need to look like for those folks. So, and I'll make sure, and Doreen's here with me in the room. Would you just make a note for me, Doreen, on the dental and vision to jot that down and make sure that we get something sent out that shows the definition. I don't think we've sent anything out yet to show what that has to look like. And again, not that that's important necessarily for us because we're not building the plans, the carriers are. But see, this is the stuff that we're going to get trained on this summer, and that's why training is so critical. By the way, Co-Opportunity Health has said they're already going to have training. It'll be that first part of September, and it'll be easily 4 hours. So commit right now to 12 hours at least. I believe Coventry said their training will be online. We'll look at whether or not we need to be offering face-to-face or not. But I think count on 4 hours of face-to-face classroom training for Wellmark and Co-Opportunity Health through KHI. So they have said, though, Co-Opportunity Health, anyway, has said they're working hard on all of this stuff, of course, because they're brand new to the market. So we'll get you something out that further defines some of the dental and vision benefits that must be covered in these plans. And then another clarification. On one of our last conference calls, our update calls, we talked about these ACA fees. Now I'm going to reach for my little sheet that I've got in here that, again, Wellmark has kind of led here in terms of coming out with some great marketing material, informational, educational material. And if you don't have this one yet, you need to get it. And just reach out to one of our staff. We've got them, and we can email them to you if you can't find them on Wellmark's site. But this is the M23510. And again, this will be probably one of those that we'll have out on our site as well. But this one is Making Sense of Healthcare Reform, a Guide to ACA Fees. So we found this to be super helpful. And as Brenda and I went through this and kind of identified the different fees, and this has got a nice code on it where you can show grandfathered, non-grandfathered, and you can also show whether it's fully insured or self-funded. And that's very helpful, too, especially when you get into some of those larger cases. So remember, these costs will be passed on to the consumer. We've heard United Healthcare say that they're going to keep it bundled in all their rates. They won't show it as a separate line item. Now, sources close to United Healthcare tell us that because this isn't part of the fee that they must cover on behalf of the employee. This is not part of the 9.5%. Remember that whole calculation? This is not factored into the not requiring the employee to pay any more than 9.5% of the premium. Remember, it's premium. It doesn't say these taxes. So I don't know about you, but I mean, are you kidding me? As an employer, I'm not passing these on to my employees. This would be something that I would end up paying for as an employer, and it's a cost of me offering benefits, but some other employee might feel differently. But just know that right now, United Healthcare can't break it out. So how will an employer be able to pass it on to their employee if United Healthcare doesn't break it out for them? So, and then here's the other interesting thing. We got into this big discussion yesterday on, well, for several days now. Remember, in the law, it says that a small group plan must offer coverage to the employee if they're 30 hours or more a week and to dependents, but it doesn't mandate them offer it to spouses. And you guys probably remember that, or you caught that. But here's where I think this is really interesting. Now, okay, let's kind of put your employer hat on for just a second. I'm an employer. Why would I want to offer, or why wouldn't I offer spousal benefits? Now, some might say, I don't pay for it anyway, so I really don't care, and I'm not going to be rated anymore on my claims experience, so why do I care? Okay, why should we care? ACA fees is why you care. Now, maybe it's not enough for you to care that much, because remember, these fees now, and I love the way Brenda put this, it's per belly button. So if the spouse is on the plan, that's another belly button. It's not counting the family as one, it counts each belly button on the plan. So if that employer is offering spousal benefits, in addition to they have to offer dependent coverage, they're going to be paying the ACA fees for that spouse, even if they don't pay for the premium for the spouse or the dependents. They're paying for it. So these are conversations that you want to be having with your small business employers to be strategizing. If they offer coverage today, what's that going to look like next year? If they're not offering it today, do they want to? And here's what you might want to look at. So even if you only take $15 or $16 per month, but multiply it out, it's over $200 a year. Okay, and that's maybe where an employer says, well, that I'm passing on to my to my employer. If they want or my employee rather, if they want their spouse on, they're going to pay their own fees for their spouse, or independents perhaps. So, but it's interesting to think about. Now, let me take it a step further. And again, as you have different questions and comments, I just want to get through some of the things I wanted to make sure I update you on today, and then I'll make sure I leave time for Q&A. But think about this now. What if an employer offered coverage to employee and children? So what it would do would force the spouse to go get coverage somewhere else. If that spouse has an employer group plan, then they should go there. If they don't, the spouse will go to the exchange or outside the exchange, which, by the way, let's correct our vernacular. It's now called a marketplace, okay? So that's another update today. So it's marketplace. It's not an exchange anymore, and I've got a funny story about that, and if I have time, I'll get to it. But, okay, so inside or outside the marketplace, that spouse could go get their coverage. But think about this. If that employer doesn't offer spousal coverage, and I got this confirmed. In fact, I had it one way one time, but now I've gotten it confirmed, and I got it with Jeff Patton, who I have a lot of faith in, and I got it clarified in my session with him a couple days ago. If that spouse is not offered coverage, and it's not mandatory for that employer group to offer that spouse coverage, let's say that employer group does not offer spousal coverage, that spousal can go into the exchange, the new marketplace, and get a subsidy. But if that employer thinks they're doing a great thing for their employee and their families and offering coverage, even if they're not paying for it, they could be doing a disservice to that family based on how much maybe they pay them, based on whether or not that spouse is employed or not. What if that spouse has their own business, so they're self-employed, and so they will need to go get their coverage, and maybe you don't pay that employee that much, and that's the income they're living off of. So these are the things that you want to have the conversation with. This is where you show your value, because you understand this well enough to know how that employer group will be impacted, how it's going to impact their people, because, let's go back to it, they should all be about, you think, how does this impact my employees as it relates to turnover? How can I make sure I secure my people? Because I'll tell you, the cost of turnover, you guys know it, and I'm going to get to that in a second because we've got a new tool to help you guys with this. and help your small group employers. So, okay, so that's it on the belly button piece, but just some interesting things to think about either way in terms of where the employer group, who they offer coverage to, who they pay for, et cetera, on their plan. Okay, so you guys should all know about the penalty, and let's just make sure that we're solid on this open enrollment thing. So here, we had a lot of conversation about this too. So the initial open enrollment period from 10/1 to 3/31 of 14 for effective dates January, February, March, or April 1. This is that open enrollment, and it's into the exchanges, and in particular for those that do not have coverage, okay? And or people that might have coverage but they want to get into the exchange. They might want to look at a subsidy. They might have coverage offered somewhere. They might be that spouse. This is the time to do it. Then after that, there will be this annual open enrollment only once now, the smaller window rather, October 15th to December 7th. Sound familiar? Part D, right? Then this time to get in for January 1 for the uninsureds going into the exchanges. So the question then obviously comes up, well, what about somebody that loses group coverage, that gets married, that comes off their mom and dad's policy, whatever these examples are? We know there will be qualifying special enrollment periods or special election periods, if you want to say, that will allow people to go and purchase into the exchange. We haven't seen those yet formally listed. As soon as they come out, we'll be pushing those out to you guys, okay? So interesting stuff here about just making sure that you're getting familiar with what's going on here. As it ties to the penalty, they're especially talking about folks that don't buy insurance today. And we know they're out there, and they're not all poor. I know we've dealt with people, and a lot of them have been because of health conditions, and the rates are just too high, and they just opt out. And I hope that going forward, that won't be an issue. They know they need to have it. It's the right thing to do. They'll buy insurance. By the way, the question also came up about HIP Iowa and the HIP Iowa Fed. Now, this question on the Fed came up with the meeting I was at yesterday with Commissioner Gerhardt. And the question was asked, what's going to happen to the people in HIP Iowa Fed? We know that they're no longer taking applications anymore. That was closed about a month or two ago, maybe, because it ran out of money. Gee, surprise. But what do you do with the people in that pool? Now, Mr. Gerhardt, Commissioner Gerhardt, made reference to them being moved into some other federal plan. Now, I am going to speculate just momentarily what that means, but please don't hold me to it. But in his comments yesterday to our group, he said that he knows who the players are that have expressed interest in the exchange. He's not at liberty to announce that yet. They don't have to make a commitment. They're probably entertaining the idea. Many carriers are. They must give word, by the way, by June 30th, whether they're going to be in the marketplace in Iowa or not. But he made mention of two, well, one company for sure that has to be in, and that's Co-Opportunity Health. And as you guys know, we're one of the 3 wholesalers, and if you haven't let us know that you want to sell Co-Opportunity, make sure you shoot us an email. Shoot me or shoot Nicole an email. We'll get you on the list. By the way, the appointment fee for Co-Opportunity Health is $40. Now, KHI is going to front that for you guys. Our expectation is, though, is that you will pay that eventually at some point, but we also imagine that you'll write business with Co-Opportunity. So the point is this, guys, that the appointment fee of $40, if that keeps you from writing health insurance with Co-Opportunity, then you may not be one of them that wants to commit to this marketplace. And I know that there's other GAs out there that are saying, hey, if you will take care of that $40 charge if you sell so many policies. We haven't even gotten to that phase yet, you guys, because we don't even have our contract yet from them to know what commissions are. So hang with me on this, but I just want you to know, the point is, we're not going to be contracting everybody and their dog, okay? This is going to be a select few that are committed to this marketplace, and those are the folks that will get trained. So we're not opening this up to try to get the whole world in here to sell Co-Opportunity Health. They don't want that either. We want the serious agents that are serious about selling health insurance that are going to commit to this marketplace, and KHI is on board with that message as well. So we'll work through that with you, but make sure you let us know. So back to my point, Co-Opportunity Health has committed, and they have to because they're part of PPACA and all the money that came from the government through PPACA for them. So they have to be in. We don't know of any other company that's committed yet. I've heard verbally okay, maybe Coventry. I've heard that verbally. I've not seen that in writing. And then Mr. Gerhardt, Commissioner Gerhardt, referred to another plan that he believes is coming into our marketplace, and he called it the Federal Employees Program. So, so this would be considered more of a multi-state plan, and we don't have anything in writing on this. It was him verbally telling us this. So I'm putting two and two together. When he answered in his comments, he made mention of this federal employee plan coming into these marketplaces and opening up their pool, if you will, and their offering to other states and other individuals. We may have another option inside of the marketplace. And then when he answered the question, though, after his talk, he answered a Q&A about what's going to happen to HIP Iowa. HIP Iowa Fed. He said they'll probably be migrated over into the federal program. So when that agent came up to me after Mr. Gerhardt's comments and said, what did he mean by that? And I just said, that's all I can speculate, that there will be a federal plan inside of our exchange marketplace, and these HIP Iowa Fed people will be automatically moved over into that. Now, I don't know that for sure. We haven't seen it. But we know HIP Iowa. We asked him this question, and what about just regular HIP Iowa? And Commissioner Gerhardt said that those folks will probably select out of. We have about 3,500 HIP Iowa clients. Now, wouldn't you like to get a hold of that list? Some of you have clients that are in HIP Iowa. Make sure you reach out to them. If you don't know who they are, if you ran it, and again, a lot of that wasn't run through us. We can give you a list, though. If something did get run through us that we were helping to keep track, we can let you know. And Doreen, if you'll make a note for me about HIP Iowa for our agents. Most of you guys, you ran it direct, and you didn't go through us because there was no override built in for a general agency. But I'll check and see if we have any tracking of that, and we can let you know. But and remember, too, if a carrier offers a plan outside the marketplace and inside the marketplace, it must be the same price. And the good news for us is also that agents are being paid inside and outside the marketplace. And verbally, I got a commitment from Wellmark that nothing is changing next year, and that nothing we got clarified and interpreted. Commissions are not changing next year with Wellmark. So if Wellmark is not in the exchange and they're outside the exchange, commissions stay the same. We'll find out what Co-Opportunity is doing. As soon as I know, we'll be sending contracts out to you guys. So then I'll let you guys know commissions there with Co-Opportunity. But Wellmarks are not changing, but just know that Co-Opportunity is paying commissions based on inside and outside, and it's the same, and their plans will be the same, and the rates are all the same. So that's kind of good news for us, too. Okay? Commissioner Gerhardt said we will be ready. If you watch the news at all, and especially Fox News, and I tend to be a regular listener to Fox News to try to stay on top of what's going on with health reform, because they tend to report a lot of this stuff, and then I have to go scramble to find out what's the truth in it and try to get to all that. But I'll tell you, it's negative, and it sounds like this isn't going to happen. You get, Senator Baucus, who was behind all this, and now he's retiring, and of course Harkin's going to be retiring, and all of a sudden, these Democrats who were so favorable, and I'm not disparaging Democrats or Republicans, it's just the politicians that were critical to some of this are now going, this is never going to work. And then we're reminded of how this deal was put together. And they talk about back rooms and 2 o'clock in the morning, and it was, so it's kind of like, okay, but you know what? I'm looking at this and I'm saying we have to figure out how to make this work. This is my take on it. So you can have all kinds of naysayers you want about what's going to happen. I'm telling you, Co-Opportunity Health is going to do their best. This is their livelihood, and their business is being built on they're going to make this work. And I've even talked to Cliff, and Cliff has said, and others have said, if Cliff Gold and Dave Lyons can't get this to work, it can't be done. So we're going to give it our best go. And anyway, you hear the naysayers, but Commissioner Gerhardt is saying, we will be up and ready. We were on a call. I was on a call, as I said earlier, with CMS and HHS, and they were talking about their applications and getting the mainframe up and the websites. So it's going to happen. Now let's just clarify again what's happening in the SHOP exchange, the Small Business Health Options Program. And remember, right now it's just 1 to 50. It will be 1 to 100 in 2016, but not until then. So right now we are just talking about 1 to 50 that can buy through the SHOP exchange or the individual exchange. And what's interesting, I think, about the SHOP exchange is people remember this and see again, I heard it on the news. Oh, the SHOP exchange is being postponed. It's not going to happen until 2015. Well, what did they really mean by that? And maybe some of you got clarification, maybe some of you didn't, but let's just get it straight now. There will be a small business exchange, a SHOP exchange. The challenge is, from a technology standpoint, what they wanted to have happen for a small business employer, and this is so cool, I think, and because I would do this. So KHI, we can go out and register as a small business, and here I put my tax ID number in. I'm a small business owner, and I want to offer plans to my employees. As long as I register, I can then tell my staff, go register inside the SHOP exchange, and you can be with any carrier, any plan inside the exchange. And I'm paying for part of it. I'm making sure, again, probably that it's affordable, but check it out. And so they could go to, I could just get registered on the exchange, and my staff could buy from Co-Opportunity, United Healthcare, Wellmark, whoever's in the marketplace. Sorry, I'll correct myself here. Whoever's in the marketplace, they could buy from anyone. That is not going to be ready by January 1 of 2014. That functionality from a technology standpoint has been pushed out until 2015, and that's what Brenda means, and that's what I mean on this when it says employee choice not available until 2015. It still means that these will be up, but now as an employer, I log on, I register, I pick Blue Cross, or I pick Co-Opportunity, or I pick whoever's in the SHOP exchange, whoever's there. If I pick that, then my staff must stay and pick that same carrier. They can't jump over and pick another carrier, okay? Okay, so that's some good stuff there, I think. And then the whole subsidies thing, this is what I want to show you because this is the updated slide. And again, we'll get this updated. I give Brenda credit here because the slide I was working on in our last update webinar was the one from 2000 that we got in 2012 for 2011 numbers. So this one we're using in 2013 for probably 2012 data, but we're using it in 2013 because they're always a year behind. But this is information that's good for right now for our conversation. So look at the percent of poverty and then look at the household size. So I don't know about you, but this is helpful, I think, to employer groups. When you sit down with somebody, and here's a good example. So let's say that I pay somebody in my company, and this is typical. There's some lower wage earners in every company, and so you sit down with that owner and you say, tell me who your lowest paid employee is. Not who, but tell me how much you pay your lowest paid employee. And if that comes out to somewhere around, let's say, $22,000, $25,000, you guys, $10 an hour, right, is $20,800 a year. So if they give you an hourly fee, I pay $10, $12 an hour. They're going to have employees that are in this federal poverty range to get subsidy. So here's the big challenge for employers. They need to make sure that if they're going to offer it. Now, I'm even talking, you guys, this impacts people under 50 especially, because they need to know, can somebody go in and get a subsidy? Remember, if that small employer, if they're only 20 employees, but they offer coverage, and it's affordable and it's quality, they've just prevented one of their employees from getting a subsidy in the exchange. So it doesn't matter if they're below or above 50. That just has to do with, are they paying a penalty or not if they don't offer coverage? And do they pay a penalty if it's not quality and affordable and one of their people goes into the exchange? So that's the penalty thing for 50. Favor by dropping them to 29 hours a week, making them so they're now part-time. They're ineligible for group coverage. Now they can go into the subsidy and get their subsidy. So interesting, just see all of this stuff. This is why having the federal poverty limits right here, knowing where people sit, and then knowing too at an employer level, what if you gave, Doreen did such a great job, Doreen's here with me in the room this morning, and if I said, Doreen, you did such a great job, and I'd like to give you a bonus of $500. What if that $500 took Doreen from one level of poverty out of poverty, from say all of a sudden 200% of poverty, and now she's up to 300% of poverty, or whatever the case is, because these are ranges, by the way. There are ranges here. And what's interesting is that might do a disservice to Doreen by me giving her a $500 bonus. Because remember, these subsidies are going to be the way that it was explained to me through one of our carriers, in particular Co-Opportunity Health, who is playing in the exchange, which, by the way, as we know, is the only place you can go to get your subsidy. They have clarified with us and said that when that person qualifies for a subsidy, then based on that, they will pay reduced premiums. If it's determined that they made more money than that, they will be trued up, and it'll all happen through their IRS return. And it won't happen until a year later, remember, so now I'm doing my tax return, estimating that I'm in this year, in 2013, I'm at this level. 2014 happens, and I'm getting my subsidy, but in 2013, and perhaps right at the end of the year, the employer unknowingly gives a bonus that still feeds into 2013 income. And so when 2014 rolls around, and I'm doing my taxes, looking back, I might actually end up owing the IRS money back for back paid premiums that I got covered for me because of my level of income. So all of a sudden, this whole thing about subsidies, and we do need to understand this, you guys, because our employer groups are going to be looking to us. Our individual clients are going to look to us to know this stuff, and this is what training is going to be all about this summer. The tools and the systems available to us to help our clients through it, but also to be able to coach our employers in terms of bonusing and pay structures, et cetera, especially for their lower paid people. But look at, 400% of poverty, over $45,000 a year. I mean, I think the statistic I heard, 2/3 of all Iowans will qualify for coverage. I think Brenda put that on one of her slides. Maybe it was this prior one, right here. It's estimated that 2/3 of Iowans will be eligible for a subsidy. So we can't, as agents and trusted people in our communities, we can't walk away from subsidies and say, I'm not going to deal with it unless you're going to walk away from 2/3 of your clients or 2/3 of the opportunity. So I think we need to figure out how to embrace it. Now, don't get me wrong. I'm not saying that we need to deal with the Medicaid population. You know, those people that make less than, let's know this too. Your very first question to somebody that comes to you and says, I want to buy insurance, I understand you can help me. Your first question is going to be, first of all, are you offered employer group coverage? Depending on the question to that, you might go another direction. Secondly, how much money do you make? How much money did you make, let's just say last year? Or how much money are you on track to make in 2013? And if they say below $11,490, you want to guide them to a Social Security Medicaid office and get some support and some help, because obviously those aren't our clients, most of us, right? Some of you might deal with some Medicaid population, and that's fine, but I'd say the majority of our agents don't deal in that population. So anyway, so just some things to know. You got to know this stuff, okay? And then here's what's key. Remember, the penalties start 1/1 of 14, regardless of when a plan renews. So if somebody's plan, if they're not offering, or they are offering, or it's credible, it's not credible, meaning right, they're offering coverage, but maybe it's not affordable, or the quality's not there, and somebody goes into the exchange, to the marketplace, the penalties will start on 1/1 of 14, regardless of when they renew. And then you guys know the full-time equivalents. Just make sure you know that 30-plus hours a week counts as one full-time employee when we're trying to calculate full-time equivalents. But then please remember that once you know you've got, and I know this is the example we went through before, so I'll skip over this, but remember, those 35 people in this example that are working 30 hours a week, those are the ones you must offer coverage to. You do not offer them to the part-times, but you had to use their hours to calculate this whole should you offer it or shouldn't you, do you get a penalty or don't you. And always remember, guys, we round down. So if somebody came out at 48.999, it's still 48, which is immaterial here. But here's the next question. Make sure you're also talking to your employer groups about, do you plan to grow your business? If somebody's this close, they'd better be offering benefits, in my opinion. I know if this was my company, I'd be offering them. Again, if it had anything to do with turnover and me wanting to retain good people, I'm going to be offering benefits, even if probably if I'm at 40. How many business owners would you talk to and say, hey, do you plan to grow? Most of them would say yes. So, okay. I'm going to end on this before we go to some more questions. I've got two things I want to talk to you about. One of them we pushed out this year, and actually I'm going to let me talk about the pay or play thing really quick. We have, for those agents that write their majority of their group business with us. So if you're split and you go somewhere else, then you know, like maybe you're going to get, hopefully you'll get your co-opportunity through us, but maybe you buy all your other stuff somewhere else. I'll work with you guys separately. But if you are with KHI, with most of your group carriers, so your Wellmark, Coventry, UHC, and you contract with us for co-opportunity health, this benefit that we want to offer to you guys through this ACA decision-making tool that will give you the pay or play calculations for your small businesses. So when you've got a small business that's sitting at 30, 40 employees, even 50 or over, and they want to know what is the financial impact going to be to me, we've got an amazing tool that we're here to help you with. So get a hold of me, get a hold of any of our account managers, Tricia, Nakia, or Erica. Thank you. Sorry, I just had a little lapse there. Get a hold of one of our account managers if you're interested in using that tool for one of your clients. We will help you with that, and it's a fantastic tool to help them decide not only should I pay or play, but how much is this going to cost me so I can budget for next year. So I wanted to make sure I told you about that. And then the other thing I wanted to mention to you is all about the agent's role. And we sent you guys out this week, and I'm going to go to that really quick here, and I think hopefully I can pull this up very quickly. And okay, great. It's probably still in my inbox. Sorry, I haven't moved it over. And let me grab it really quick here. I think Nakia sent it out, or came from all of us here. Let's see, KHI. Oh, sorry. Come on, come on. Okay. All right. Yep, having trouble finding it. If you don't have it, let me know. I know I've got it here somewhere, but it's the information on the broker's role in all of this. And the cool thing I want to tell you about, and I didn't see it on that application, but they've committed that on every application there will be a place for the customer to put the agent or broker name and their number. So know this, that you guys will be asked to complete some online training to utilize this exchange, but it'll also be true on or off the exchange, as we know this, because there'll be a place for you on the application. You maybe send it to somebody, but you'll want to send it out to them, and we'll help you with this. Make sure we get your number tied to it. So if they end up sending it in directly to the carrier, either electronically or via paper, that somehow you'll be tied to that and you will be compensated. So that was huge, just to get us as a presence on there and on the application, so that there's no way that we can be missed, that they know. And either they work with you directly and you take care of it and get it submitted, but just know that there'll be a certification process for you, okay? So let me go back to here and open up the phone lines, and I know we're getting close to the end of our time together today, but let me unmute you guys. Let's see. Okay, see, and I had this trouble before. Let me get to the microphones here. Oh, come on. Darn it, and I thought I had the place where I put in my code so I could ask you guys for questions. Nope, okay, I was trying another technique here. Darn it. Okay, you guys. I'm so sorry. I'm trying to figure out how I can Here we go. Attendees can ask questions. I think I had that. You can raise your hand and do it. Why don't you guys try the chat if you can see that on your computer there. If you can type a question, there's a little chat box there while I try to figure out if I can get the audio changed. Oh, this is frustrating. Okay, let's try. I'm going to try one other place. Stay with me just another moment here. Oh. Okay. Let me see. I've got a question here. Here we go. Will training also have CEC credit? We think that training will have CEC credit, you guys, and I know they're being filed for now, and so that's the answer to that question. We plan on there will be some continuing ed credit. But it's funny, I've kind of even said to the carriers, let's not promote that, because the training really isn't for people just to come and get their continuing ed. It's really for the people that are committed to this marketplace. So, boy, you guys, I apologize. We are on our GoToMeeting webinar, and I apologize because it's my problem here that I can't figure out how to turn the microphones back on so you guys can hear from us. So, anyway, if you have any other questions, why don't you go ahead and shoot me an email, and we'll be in touch, all right? So thanks, you guys. Hey, have a great weekend and a great day, and we'll be in touch. Take care. Bye-bye.